In today's video, we will discuss fatty liver and 3 essential aspects you should be aware of. Firstly, it is important to understand that fatty liver occurs when fat accumulates in the liver, which can affect other bodily functions as well. The fat-soluble vitamins such as vitamin A, D, E, and omega-3 fatty acids are extracted from this fat, enabling our body to absorb and digest them effectively. These vitamins and acids are crucial for our health, but if the liver is not functioning properly, this process doesn't occur efficiently. The liver produces bile, which helps break down these vitamins and makes them usable for the body. If the liver faces problems and cannot produce bile, these essential vitamins are not absorbed by the body, leading to deficiencies and potentially causing issues like increased cholesterol, gas problems, bloating, and an increased risk of gallstones. The liver also produces cholesterol, about 1,000 milligrams daily, and to process this cholesterol, the liver creates certain proteins known as lipoproteins. These carry HDL and LDL throughout the body. Moreover, the liver can produce glucose, a process called gluconeogenesis, in which the liver uses fats and proteins to create glucose, meaning that carbohydrates are not necessary for this process. So even if you are on a low-carb diet, your liver will still be able to produce glucose using fats and proteins. This is why a low-carb diet is considered safe. The liver also has a critical function of converting ammonia into urea, detoxifying harmful substances like chemicals and drugs, and removing them from the body. Given the wide array of functions the liver performs, it is essential that the liver remains in good condition for optimal health. Symptoms of fatty liver. 1. Chest pain. When fat accumulates in the liver or there is inflammation, cirrhosis, the liver size increases. This can exert pressure on the heart, especially when you lie on the left side, as the heart is located on the left side of the chest. 2. Gynecomastia, male breasts. When the liver cannot filter the estrogen hormone properly, estrogen levels rise while testosterone levels drop, leading to estrogen dominance in men. 3. Night blindness. This condition occurs when vision becomes blurry or worsens in low light. This is caused by vitamin A deficiency, which is a result of the liver's inability to produce bile for its absorption. 4. High cholesterol. Without proper bile production, the body cannot process cholesterol, leading to increased cholesterol levels. 5. Diabetes, blood sugar. The liver regulates blood sugar levels, and if the liver is not functioning properly, this can lead to blood sugar imbalances. 6. Irritability. Increased blood sugar levels often lead to mood swings and irritability. 7. Bad breath. In some cases, people with fatty liver may develop bad breath. Causes of fatty liver. High insulin levels, often due to a high carbohydrate diet. Gastric bypass surgery, which alters the digestive system. Low protein intake or inadequate protein in the diet. Certain medications, steroids, or viral infections can also contribute to fatty liver. The most common cause, however, is high insulin levels, which occur from excessive carbohydrate consumption. How to manage fatty liver. To manage or prevent fatty liver, it is essential to adjust your diet. You should consider adopting a low-carb, high-protein diet. Protein deficiency can contribute to fatty liver, so it is vital to include an adequate amount of protein in your diet. If you notice any of these symptoms, it is crucial to consult with a healthcare provider and have your liver checked. Regular health checkups can help detect liver issues early, leading to better management and prevention of complications. Like and subscribe this channel for more videos about health. Take care of your health, and I will see you in the next video.